Got my sanitizer. Hi, how are you?
I'm good. How are you?
Good. My name's Teresa. I'm a physical therapy assistant student at Penn State Hazelton. Is that okay if I work with you?
Yep.
All right. Can you just verify your name and date of birth?
Grayson Allen, October 21st, 2004.
All right. And do you know where you're at today?
Penn State Hazelton.
And do you know the year?
2025.
Perfect. Okay. So I was just reading your chart and I saw that you were diagnosed with ALS a month ago, and you just have difficulty with walking. You have recent falls,
Yeah.
and you have upper trap pain. Is that correct?
Yeah.
Okay. So today we're going to be doing some exercises, but we're going to be focused on pre-mod stimulation over here with this Chattanooga machine. This will just help relieve some of that pain and help you mobility in that area. Okay? All right. So before we get started, I'm going to put this gait belt on you just in case you may lose your balance. And during the treatment, you should feel some tingling, but it shouldn't be any painful. It should be strong but comfortable. And then you shouldn't have any pain during this, or I'll just do it in there. Do you guys have lab, right?
No, I have to do my
Oh,
assessment.
okay.
You guys are fine. We don't start until 9.
Until 9? Okay.
Yeah, you still got 15.
Okay, alright.
Yeah, you keep doing what you're doing.
Here, I'm gonna put my paper on you. Okay, again, you shouldn't feel any pain. If you do here or at your home exercise that I give you, just let me know and reassess. Okay, so before we get started, I'm gonna ask some contraindications and precautions. So
Okay.
I wanna do it over carotid sinus, laryngeal, pharyngeal muscles, or eye area. Over malignancy, where active range of motion is contraindicated while operating heavy machinery, no active bleeding or pregnancy, cardiac pacemaker. My patient is oriented, so that's good. Cysticized skin, and I want to do it over open wounds, superficial metal implants or stimulators, or extreme edema. Your skin may be irritated during this, but it's totally fine. This is for external use only. Arrhythmias or myocardial disease, and keep out into children. Okay, so first I'm going to assess some range of motion, so if you can hop up on the table. All right, so your skin's all intact back here, so that's good, and I'm just going to check your upper trap. Can you just point to where that pain is?
It's right there.
Right here? Okay, so that's intact. Very good. So what I'm going to have you do is you're going to lift this leg up towards the ceiling. Very good, and I'm just going to measure it over here. You can relax. Okay, whenever you're ready, you can go ahead and do that. All right, you can relax. All right, you got 18 degrees. Normal is 20 degrees for hip extension. And now we're gonna do a manual muscle test. So if you can bend that knee up and show me that motion again. Good, come halfway. Oh, you got a cramp, okay. Okay, so if you could do that again, and we're gonna come halfway. All right, and hold, and right again, so ready, go. 1, 2, 3. How was that? Okay, I will give you a 5 out of 5. Okay, you can come sit back in this chair. So on a scale of 0 to 10, 0 being no pain, 10 being worst pain imaginable, how would you rate your pain today?
A 5 out of 10.
A 5 out of 10?
Yeah,
All right,
it just
and
hurts
then-
all the time.
Okay.
Oh, sorry.
No, it's okay. Let me just look. Perfect. And I'm gonna do a sensation test on
Okay.
the other side.
Oh, okay.
So this is light
Okay.
and this is deep.
Okay.
Okay, so you're gonna close your eyes and tell me what you're feeling.
Okay. Like, do you,
Perfect. And are these feel the same?
yeah, they both feel light.
Perfect. Okay. So your skin's intact. Do you currently work?
Yeah.
Okay.
Yeah.
And what do you do for work?
I work with computers.
Oh, very nice. Okay. And does this affect any of your daily activities?
Yeah.
Like what?
I I can't reach stuff on my desk and like bring it to me. Like I can't. It just doesn't. I can't get it.
Okay, all right. Prior to this injury, were you more independent, dependent?
I was independent.
Okay, all right. And then what are your goals out of physical therapy today?
I just want to be more independent and just not
Okay.
progress as much.
Okay, all right. And I checked your skin, it's good. I palpated it, it's good. Okay, so I'm gonna first clean your skin over here. You said the pain's right about here?
Yeah.
Okay. And I will give you a call bell right here, just in case I'm working with a patient, you know, just ding it.
Okay.
So I'm on pre-mod. My sweep is off. My beat fix is 100 hertz. My cycle time is continuous, and I'm gonna be doing it for 20 minutes. So I'm just gonna come over here and put it around the pain. It's cold. Sorry. Okay. All right. So again, this should be strong but comfortable. So you're gonna let me know when you start feeling a tingling sensation.
Okay.
How's your morning going?
It's going good. How
Good.
is yours?
It's going.
Oh, I'm feeling
You're
it.
feeling it? Okay.
Yeah.
So let me know when it's strong but comfortable.
Okay. That's good.
Okay. So we're gonna start that for 20 minutes. Okay. So while you're on here, I'm just gonna go over some home exercise program that you could do. So do you have a heating pad at home?
Yeah.
Okay, so you're gonna put that heating pad on your upper shoulder right there. And there should be one layer in between, so put it in a pillowcase or a towel over it. You should do it for 15 to 20 minutes every day. And again, it shouldn't feel any pain, but you wanna check the skin every so often. I would have let you, I would have had you do some range of motion before, so we'll check it after again. I'm gonna give you a number for support groups, so some people who also have your diagnosis, so you can just talk with them, make sure you have good lighting and you declutter anything when you're doing this home exercise program.
Okay.
Okay, again, if you have any pain with it, stop and we will reassess the next time.
Okay.
Okay, so it's been 20 minutes, so I'm gonna stop. Perfect. How was this?
It was good. I liked it.
All right, so on a scale of 0 to 10, 0 being no pain, 10 being worst pain imaginable, how would you rate your pain?
3 out of 10.
3 out of 10, perfect. Okay, so it definitely decreased, and if you can just do range of motion, up, down. I would have checked this in the beginning. Oh, perfect. So you can also do that at home as well.
Okay.
So I'm gonna check your skin again over here. It's intact, that's good. And I'm gonna have you hop up on here and check that range of motion to your right hip again. Skin's intact back here. Again, the shoe and sock off, but it's good. All right, if you can just do that motion again. Perfect, and then bend your knee up and go again. Perfect, okay. So you can come have a seat on the chair. Do you have any questions?
No.
All right, I'm gonna take your gate out off. And thank you for letting me work with you.
You're welcome.